Good evening, friends. Good evening to all of you. Today we will learn about the last topic of this chapter, that is disorders of excretory system. Disorders of excretory system. See, friends, there are conditions when your kidney do not function well and kidney fails to filter the blood and make urine. Then what happens? The urea will accumulate inside the blood. That is the condition called uremia. Uremia, the accumulation of urea in blood when your kidney is not functioning good enough. Okay, so to treat these kind of patients, we have artificial kidney. So what we will do, let's say this is the patient, and this patient, the from the patient, from the convenient artery, the blood will be withdrawn, and by adding some anticoagulating agents like heparin into it, we will send this blood to the artificial kidney. This artificial kidney has a coil tube called cellophane tube. It's a coil tube called cellophane tube. Have to remember the name cellophane. This cellophane tube has little pores in it, and also this kidney has a dialysis fluid which contains all the elements like your plasma contains in the blood except nitrogenous waste. So nitrogenous waste will be not there, but all the components in the plasma will be there in this fluid of artificial kidney. So what will happen when we filter out? We'll take this blood. We will add heparin, which means anticoagulating agent, so that your blood should not be coagulated whenever the process is going on. That's why we are adding heparin here. Then that blood containing heparin will be sent to the artificial kidney, which has this cellophane tube having little pores, and also we have uh, this fluid, dialysis fluid. So this process is known as hemodialysis. So what will happen? The blood contains nitrogenous waste. We have to remove those. Where these waste will be diffused from these pores, from their higher concentration to lower concentration, because this fluid do not have nitrogenous waste. Blood has nitrogenous waste. So nitrogenous waste will be move out of this tube and go into the dialysis fluid, and those waste will be we can containing the nitrogenous waste we can remove. So this will be the urine of that patient, and then this pure blood will be again transferred to the patient with the help with convenient vein. This pure blood will be again transferred to the patient. So your kidney is doing that the same function we are doing in the artificial kidney by the with the help of this cellophane tube inside the artificial kidney. Okay, so this is the process known as hemodialysis. Hemodialysis. Okay, so this thing you have to remember. Then there are some other conditions like uh, renal calculi. Patients who are suffering from the kidney stones. Renal calculi means kidney stones. Little they form little stones of insoluble crystalline masses like oxalates in their kidney or in the urinary bladder or in the urethra or ureter. They form some insoluble mass of crystalline salt. This thing can be painful, and they resist your urine path. Okay, so renal calculi is the most common disorder, we can say disease, we can say, Okay, then there is a condition called glomerulo glomerulonephritis. In this case, inflammation will occur. Inflammation of inflammation of glomeruli, glomeruli of kidney. So these two three things you have to remember in the disorder. Okay, so this was about, guys, this was about disorders of excretory system. We have covered all the topics of NCRT here. I hope it is helpful to you. If you found these series helpful, please hit the like button and subscribe to my channel to get more and more knowledge like this. Okay, so thank you so much. Thank you so much for all your support. We will meet in the next video having a next chapter.